the next target, the next prey, the piece of meat in the middle of the table of the main 4 tobacco industry companies, it's Africa. Africa is now the target, and they are starting with cigarettes, and they are doing these nicotine pouches and so on, which are harmful.
What keeps me passionate is the fact that I look at things in a systematic way, holistically, not in silos, not fragmented. But I realize that for us to move the needle further, we need to adopt a holistic approach, a health systems thinking approach. And I guess maybe that's why on different issues, different topics, I seem to be passionate about it, because I realize that every piece in the jigsaw is really important.
It has been shown since few years that if you increase by 10% the taxes on a cigarette pack, it decreased by 4 to 5% the smoking prevalence. I'm optimistic about that. The fact we have the measures to decrease the smoking prevalence and the use of tobacco products. I'm a bit pessimistic about the fact that they have to be implemented.
We really don't want to have people coming in with cancer. We all know prevention is better than cure. How do we get people to understand that they do play a role? They have a role to play in preventing cancer. How do we make them understand that lifestyle modification is critical in preventing cancer?
What do billionaire tobacco giants and a budding Nigerian research institute have in common? Both are shaping whether you, me, and the next generation live long enough to worry about retirement plans. Welcome to Paul Talk Science, where big ideas trade elbows with real-world messiness, and someone come out hopeful on the other side. I'm your host, Paul Adepoju. I recently reported from the electric corridors of the 2024 World Cancer Congress in Geneva, where the coffee was strong, the debate stronger, and the stakes were nothing short of life and death. Today's show is a double header with 2 guests who operate at opposite ends of the cancer control chessboard, yet need each other to win the match. Meet Yannick Romero, Senior Knowledge and Advocacy Manager at the Union for International Cancer Control. Yannick wrangles global treaties, lung cancer coalitions, and the delicate art of convincing governments that slapping another tax on cigarettes is not political suicide, but public health common sense. He'll pull back the curtain on 20 years of tobacco diplomacy, monster profit margins, and why e-cigarettes are the industry's latest Trojan horse. Fly 4,000 kilometers southwest and you'll find Dr. Amaka Lasebikan, clinical oncologist and, brace yourself, Director of Research and Innovation at the brand new Nigerian Institute for Cancer Research and Treatment. The institute is juggling everything from AI-powered diagnostics to a National Cancer Health Fund, all while boosting the number of working radiotherapy machines from maybe 2 a decade ago to 8 today and counting. Put them together and you get the macro and the micro, the treaty and the treatment, the policy and the PET scan. Proof that conquering cancer is a relay race where the baton has to travel smoothly from Geneva's plenary halls to Abuja's clinic always. Expect sharp insights, a few laughs, and because optimism is mandatory here, a clear path to a smoke-free generation and in Nigeria where a cancer diagnosis isn't a financial death sentence. Strap in, dry strat now, cue the music, crank the volume, and let's meet Yannick Romero. Yeah, so name and position.
Yannick Romero, Senior Knowledge and Advocacy Manager at the Union for International Cancer Control.
How long have you been with the union?
A bit more than 7 years.
What's your current portfolio project that you are working on?
Well, I have different portfolios that are linked to each other. I would say not in the priority order. Tobacco control, which is really supporting our members and the tobacco control community and cancer community to work together on a lot of different aspects, and working with the WHO Secretariat for the Framework Convention on Tobacco Control. The second one is what we call the lung cancer collaboration. So it's to work with also different stakeholders to raise awareness about lung cancer care globally, and working also with different stakeholders such as the WHO, the WHO IARC, UICC members and partners, and so on, and national cancer societies. And the third one is national cancer control planning. Same, working with different stakeholders in supporting the cancer planners, what we call national cancer control planners, to develop and implement their cancer strategies, working together with also WHO and the International Agency on the Atomic Energy, IAEA.
Wow, you're a big deal.
Not sure about that.
There is a lot of pessimism around the progress on tobacco control. The data is clear. Everybody knows what to do, but it seems to be going at snail speed. Do you agree? What is your counter argument regarding progress in this space?
I think that there were progress because in terms of diplomacy and political will, international political will, you have a treaty that will celebrate 20 years next year with a really large number of countries, signatories to that treaty. The fact is that the implementation of that treaty depends on the domestic context. It depends on a lot of resources. We saw that the smoking prevalence decreased over the last few years in globally and in some countries. The fact is that there are also the number of smokers did not increase, the prevalence decreased because of that treaty. So, and also the involvement of the different stakeholders in implementing that treaty and all the measures that are coming with this treaty specifically, such as smoke-free environments, so smoke-free places and so on, indoor smoking, indoor bans and so on, bans on tobacco advertising, promotion, and sponsorship, which is one of the key aspects of the activities and measures that have to be implemented to decrease the prevalence of smoking. Increasing, and one of the most cost-effective measure is increasing the tax, and that's also could be difficult to understand for the public, but also the governments. They don't really like to increase the taxes because it's bad, but it's a tax that is addressed to decrease the prevalence. It has been shown since few years that if you increase by 10% the taxes on a cigarette pack, according to the context, I would say the income setting, it decreased by 4 to 5% the smoking prevalence. So I would say I'm optimistic about that. The fact we have the measures to decrease the smoking prevalence and the use of tobacco products. I'm a bit pessimistic about the fact that they have to be implemented, and also countries, civil society organizations have to counter the tobacco industry influence, misinformation, their so-called transformation. And as an industry who is making high profits, there are some numbers that we've heard here during the conference. It's a really high profitability industry. I think I might be mistaken, but we have to double check those numbers. But the 4 to 6 major tobacco industry companies are making more profit than the major companies in the world like Coca-Cola, Heineken, and others. So, and they are making margin such as 50 to 70%, which is huge compared to the others that are making only maybe 15, 20%. So they want to keep that money for them, and they want to keep people using their products. The product is tobacco with nicotine. So they kind of innovate in the way they distribute that nicotine, and they use other aspects of the cigarettes. We call the e-cigarette, the heated tobacco product also, which are tobacco products, nicotine pouches, and also the fact is that they want to hook a new generation, because it was shown that if you have an addiction, if you are starting to smoke or use tobacco product before the age of 18, 19, you will stay on the addiction for almost your whole life. So they want to hook children, actually. That's the thing, is that they hook children just to have them for 30, 40 years and to spend their money on that addiction.
Now, anytime I think about this tobacco issue, Article 5 and I think it's empowering to see that kind of document. And from this conference, we are hearing conversations like if decisions want to be made around a company's product, that the company not to be part of the decision making. But I've been to side events by countries that want to introduce some policies that still have the private players, not really tobacco companies, actively involved, sometimes actually being the ones helping them to draft that text. So we are chasing the tobacco companies away, but we are co-opting the pharmaceutical industries to write national cancer policies. So in all sincerity, how do we balance this?
Well, I think that's I'm not talking about in the name of any industry. I'm just talking in the name of as a citizen. And here you can see the difference between a tobacco industry company and a pharmaceutical company. There's one who is selling a product that will certainly kill 50% of their consumer. If you do a drug, I'm not talking about oncology, let's talk about any other pharmaceutical company. If you have a headache and you take paracetamol, I'm not sure that if you develop a drug for headaches, it won't kill 50% of your consumer, except if you don't respect the dosage and so on. So that's the issue. At the same time, we have to make sure that the economical interest and what we call the commercial determinants of health, and there is a separation between the industry and the national policies, but they have to be part, and to talking about any organization outside the, I would say, the sin companies, alcohol and others and tobacco. But I think that every stakeholder should be around the table. When there's a question about a national strategy, cancer, tobacco, any strategy, you have to bring different sectors that are part of the city. Actually, we call citizens and the city. And you have the patients, you have the experts, the civil society organization, the survivors, but also the private organizations that can do something. I'm not saying that. Yeah, I think that they need to be part of the process, and they have an influence, but not a full influence, but they have to be part of the dialogue. Contrary to the tobacco industry, they don't want to kill anyone.
Yes, so now, crazy question. This is a crazy question. Has it ever been done to work with the tobacco companies?
But who, what do you mean?
You know this sector more than me. I'm looking at the Godfather. Look at the margin of profit, billions of dollars every week. You can't expect them to just fold their hands and say, okay, we are falling on our sword, we are tired, we are packing up. So is there a counter approach to redirecting the tobacco industry to something entirely different?
It's a complex question, because you're asking an industry to transform. The thing is that they are selling a product that kills people, and they do huge margins. This is kind of the narrative and arguments that they are trying to sell now, is that, they took ownership of some of the narrative that was used by the tobacco control community. Alternative, they use the term harm reduction, and they use that harm reduction, which is taken from the drug control community. And I think this is kind of the manipulation that they used. They used a lot of manipulation because they want to keep that money for them. And clearly, and we've seen in that conference and other conferences, and that's the issue. So you asked me for an advice for the tobacco industry. Well, stop making cigarettes. That's it. They try just to transform, but this is their narrative. We want to transform. You know what? It's completely false. What they said, they launched a campaign a few years ago about the smoke-free generation, smoke-free future, something like that. And they are saying, well, not to target a specific one, but they have this eat not burn or eat tobacco products saying, oh yeah, just switch to that, we will develop and so on. And I've seen that they are opening new factories in countries, but not for eating tobacco products, but for cigarettes. They're opening new factories for that, which means that they're completely lying in the face of everyone. And it's a marketing strategy, that's all. For people in high income countries, and even now they are just starting to introduce their product in low-income countries, and so that's crazy. And then the next one, I would say, the next target and the next prey, I would say, and sorry for that term, and the piece of meat is in the middle of the table of the main 4 tobacco industry companies. It's Africa. Africa is now the target and the prey on the table of those. a piece of meat. And they are starting with cigarettes, and they are doing these nicotine pouches and so on, which are harmful.
Probably last crazy question for now is, how do you see this ending? Because we know common sense usually prevails in the history of humanity. So how do you see this whole campaign ending?
That's a tough question. I never reflected on that, really. I hope that it will end by, if we want to end tobacco industry and the production of those products, it needs just the alliance of every stakeholders, which means that you have to involve the government, you have to show them that making a health investment into banning tobacco products would benefit to the whole society. And it has been shown that you have a better productivity, you increase the health of your population, you increase the wealth of your population. And I think it's key. So it's a stepwise approach. I would say that it's not a prohibition. And this is why we hear the term generational ban or endgame, is that we need to start somewhere. We need countries to pioneer that end game, and it takes years. It takes years just to reduce the prevalence, the smoking prevalence, the use of tobacco products, and we have to convince the government that there is a new generation that should not know what is a tobacco product.
Yannick, that was awesome.
I don't know.
My name is Dr. Amaka Lasebikan. I'm a clinical oncologist by training, and I'm currently the Director for Research and Innovation at NICRAT. That is the Nigerian Institute for Cancer Research and Treatment.
So take us through the NICRAT journey and history, and what necessitated the need for NICRAT. Where is it? Are we currently, and what division should be summarized?
I like that summarized. So NICRAT was established by NICRAT Establishment Act in 2017. However, it became fully operational last year. So it's just about a year old. Now, the mandate of the Institute is to provide leadership on oncology-related activities in the country. And so the activities include the entire cancer control continuum. So we're supposed to provide leadership and direction for early detection strategies, for diagnosis, for treatment, all the way to survivorship. We're also involved in some fundamental pillars that support cancer care, which includes access, both ensuring that facilities are in place, the infrastructure is there. We're also involved in ensuring workforce development. We're also involved in innovative funding solutions, because we all know that cancer is associated with catastrophic health expenditure. So right now, the uptake of NHIA is low, and we know that cancer care in itself is expensive all over the world. People affected living with cancer often have to pay out of their pocket. Can we support them continue along their cancer journey? So these are some of the other building blocks, in addition to main aspects within the cancer control continuum that NICRAT is involved in. Another major area of NICRAT, the name is Cancer Research and Treatment. We are supposed to set the research agenda for the country. The world is going towards precision medicine, really trying to focus treatment on the patient's tumor characteristics, taking into consideration the tumor type, the patient's structure, and all of those things. So NICRAT is heavy on research, conducting research, trying to understand what kind of cancers we have, the tumor biology, trying to understand how we can improve early detection strategies, really trying to contextualize it. Also trying to leverage on AI in helping us to solve that problem. We do have a workforce that is limited. How do we leverage AI to bridge that gap? We're also really interested and involved in cancer research, building research capacity for young leaders, and also providing funding for research of early career investigators and also mid-career investigators who do have the experience to ask the right questions.
So there's a lot of enthusiasm in the room, people from different organizations sharing the vision for that. But back home, when you look at the attention that communicable diseases have compared to NCDs, the gap is still very, very wide. What is happening to ensure that the momentum from this meeting is sustained back home when you get back?
So you are quite right. Nigeria, one of the LMIC countries is struggling under the dual burden of both communicable and non-communicable diseases. However, the burden of non-communicable diseases, particularly cancer, is rising, and it's something that we cannot neglect. So there's a lot of enthusiasm to support cancer treatment now. There's a lot of advocacy by influential people in the government, people that are real stakeholders to try to promote cancer care in the country. We know that is not enough, which is why we are happy with NICRAT, because this is a first bold statement to say that we are prioritizing cancer in Nigeria. So the onus now is on NICRAT to make that investment case as to why the investment must continue to support cancer care in Nigeria.
I think the end result is still for the people living with cancer to improve their lives. And for those that are still reluctant to say, oh, Nigeria is not doing a lot about cancer, what we do describe as what you are so proud of that has been achieved in terms of improving the lives of individuals living with cancer in Nigeria, that we can say, okay, these are the success stories and evidence-based.
So let me say, first of all, that yes, we are interested in making the journey easier for those that have cancer. But one priority area is in prevention and early detection. We really don't want to have people coming in with cancer. We all know prevention is better than cure. How do we get people to understand that they do play a role? They have a role to play in preventing cancer. How do we make them understand that lifestyle modification is critical in preventing cancer? So these are some of the areas that we are also prioritizing, in as much as we also want to prioritize care for those that have cancer.
Now, the health fund is burgeoning, not enough fund to go around every health issue. So what is the realistic funding strategy to be able to implement all of these NICRAT ambitions?
One of the innovative funding solutions that has come up is the Nigerian Cancer Health Fund. It was a pilot program put in place by the government. It's about 4 years now. And the whole idea was to provide funding at 6 pilot institutions across each geopolitical zone for people, indigent people. That was the criteria. Indigent patients living with breast, cervical, or prostate cancer to go to these institutions, designated institutions, and access their treatment there. Treatment would cover diagnosis, it will cover surgical treatment, medical oncology treatment, radiotherapy treatment, supportive care, as well as there's a token to support transport. Because if you have everything they need at this facility, but they can't bring themselves there, then it's an exercise in futility. So we have all of that within that package. What are we doing to sustain it? The investment that was put forward, it was co-created by the government. The idea behind it in terms of sustainability was to get a lot of private sector involved. Private sector involvement, we know, is critical to the sustainability of that. With this government, they are also expanding the reach, not just private sector, CSOs, NGOs, and farmers, and all the private sector, but also looking at the huge population of Nigerian citizens in the diaspora. So this is an untapped resource that the present administration is looking into. But to be able to push that agenda, we have to be as transparent and accountable as possible. So this is what is currently going on now. We're transitioning from the initial pilot to a more structured one that has accountability as its watchword.
Well, how would you describe the prospect? From everything you described now, the prospect of cancer care in Nigeria, at least from what you know that is you are directly involved with?
10 years ago, we probably had maybe 1-2 radiotherapy machines functional at any given time. That number has increased to about 8, thereabout. It's not nearly enough, but is it progress? Yes. Huge geographical disparities exist. We agree, but that is some progress. In terms of diagnostic capabilities, there's also been some progress with that. One of the high-end diagnostic modalities, which is a PET scan, patients that really, really needed this service would often go to countries outside of Nigeria, like Kenya, Egypt, and some India to access it. But we have one now in Nigeria. One is not enough, yes, but it's a step moving forward. So in terms of infrastructure, we seem to be making progress. In terms of workforce development, there's more awareness now. However, there is a drop in the workforce, not just in oncology, but across the health sector. And we do know that because it has huge economic problems at the basis of that. So we have lost quite a number of our specialists to greener pastures. So workforce, we need to think about it. The federal government is putting in place certain strategies to try to shore that up as quickly as possible. So in terms of infrastructure, human capacity, there's work ongoing with that. And then innovative financing solutions, trying to improve access. We're also taking steps in that direction. And most importantly, we do not seem to have any data collecting real world evidence, which is where the research directorate comes in. We do not also have data that really looks at the genomic diversity that exists in Nigeria. So we don't know whether those drugs will work the way they have been presented in those landmark papers in our patient population. Again, this is where the research directorate comes in. The whole idea is to ensure that the treatments which are toxic actually cause more good than harm in our patient population.
You speak passionately. So what was your journey like, and that still continues to keep you this passionate on this subject?
Well, incidentally, when I got into residency, I initially wanted to do radiology. But even as I wanted to do radiology, I just wanted to try to understand cancer and oncology. And then there was this opportunity. Oh, they're looking for people to go into this particular specialty. And I thought, aha. So that was how I joined it. I wasn't actively looking to join it, but when I got into it, I began to see the gaps. I identified so many gaps, in what we're doing. And at the very young stage in my career, I went around for conferences and I saw that in other climes, it could be better. And so I came back and I started asking questions. Why is it not better? Why is it not this way? So I would say that what keeps me passionate is the fact that I look at things in a systematic way, holistically, not in silos, not fragmented. But I realize that for us to move the needle further, we need to adopt a holistic approach, a health systems thinking approach. And I guess maybe that's why on different issues, different topics, I seem to be passionate about it, because I realize that every piece in the jigsaw is really important.
That's beautiful. Any last remarks for me?
We need to get the right information out there. I don't know whether you're aware of the not so pleasant experience we had when we rolled out the HPV vaccination. We did not follow an evidence-based approach in engaging the stakeholders, who are the people that would benefit from it the most. Either the people themselves, the caregivers, the religious people, the society. We, like it or not, we are a very cultural and societal people. We didn't get the message out there. The media also did not help in inflaming the anti-vax. So I think for people in this line of work, I would say, do the due diligence, work with the caregivers, work with the policymakers, so that we can truly get the right information out there to the people, and they can then make an informed decision as to the type of care that they would receive.
Wow, that's powerful. Thank you so much.
You're welcome.
I really enjoyed that.